Moving on to another formed element, the leukocytes. Leukocytes, or the white blood cells, are complete cells. They are different from red blood cells in that they have a nucleus, they contain all the essential organelles, thus they have a longer life than red blood cells do. They're much less numerous than red blood cells. While red blood cells make up about 45% of blood, white blood cells or leukocytes usually make up less than 1% of the total blood volume, and their function is to fight infections. There are many different types of leukocytes with different individual roles. You're not going to be specifically responsible for knowing what these different types of white blood cells do, but you should at least be familiar with these 5 as being types of leukocytes. So when you hear neutrophil, lymphocyte, monocyte, eosinophil, or basophil, you should know that we're talking about leukocytes or white blood cells. So specialized hematopoiesis to make white blood cells is leukopoiesis. So specialized hematopoiesis to make our leukocytes. Typically, we have a low number of circulating leukocytes. It's kind of like the patrol of the blood, where we're going to have a low amount constantly circulating just to make sure everything is okay, that we have no infections that we need to be concerned about. Leukocytosis is an elevated white blood cell count. This is a normal immune response to a pathogenic infection or disease. So when we notice that there's leukocytosis, or when we notice we have more white blood cells than we should, that indicates that there is some sort of infection within the body. Leukopenia, on the other hand, is a low white blood cell count, and this can be caused by aplastic anemia, where the bone marrow isn't producing white blood cells properly. It can be due to an overactive spleen, which the spleen is actually recycling them too quickly, leukemia or other cancers, or infectious diseases such as HIV or tuberculosis. So normally we should have a certain number of white blood cells or leukocytes circulating the blood, about less than 1% of our blood volume. If we have an elevated amount, that's leukocytosis. That usually indicates we have an infection. If we have less than what we would expect to have, that is leukopenia. And that also indicates that there is something that's going on incorrectly with our white blood cells. Leukemia is one of the main leukocyte disorders. Leukemia is cancer of the white blood cells. There's many different types of leukemia, depending on what specific leukocyte is being targeted in terms of that cancer. In general, what happens with leukemia is that the marrow becomes occupied with cancerous leukocytes. These are non-functional, usually immature white blood cells. They don't die at their normal point of life, so they kind of hang around, but they're non-functional. They're not able to fight infection, and now they start to crowd out the other formed elements. They start to create less room for the red blood cells, create less room for the platelets. So complications would be secondary infections. If we're producing non-functional immature white blood cells, we're not going to be able to fight off infection. Anemia due to the crowding out of the red blood cells. Internal hemorrhage due to the crowding out of platelets. Leukemia treatments would be irradiation, anti-leukemic drugs, bone marrow or umbilical cord blood transplant.